My name is Marcy Vandament, and I went to the University of Kansas for my bachelor's, my master's, and my PhD. So my bachelor's is in developmental psychology, and my master's and PhD are in counseling psychology. Early on in college, I started doing a lot of career exploration. So figuring out what that was, and some of the things that I landed on that I really liked were teaching, working with people, and doing research. So that really narrowed down some careers for me. And as I started to do more research into psychology, particularly into neuropsychology, I realized that that would allow me to do all those things. And so that's really why I started to pursue that. And then in terms of the patient population I work with, I love working with kids, and they're just fun little humans, and I have such a great day. It doesn't even feel like work for me when I'm with patients, because I just see how they're growing and learning, and it just makes me love my work days so much. So my specialty is in pediatric neuropsychology, and what I do is, what I'm really interested in is bridging that gap between the medical world and the psychology world. So you have X medical condition. What does that look like in real life? Real life being, since I see pediatric patients, what does that look like at school? What does that look like at home? And what kinds of services can we get in place for that patient to help them be most successful in their environments? My specialty is in epilepsy, pre-surgical epilepsy cases. I also see patients who have things like tumors that have recently been resected or are in treatment. I also see kids who maybe were born early, so premature birth. So the big emphasis here, though, being a medical condition. So when you come in to see me, you'll see me across 3 appointments. So first, I'll meet with the parents or the caregivers, and we will talk about the history of the patient from birth to present and some of the concerns that they might have. And in that second appointment with me is when we'll actually do the testing. So it's about a 4 to 5 hour appointment, depending on the patient age. So do a variety of different measures of intellectual functioning, memory, executive functioning skills. And then finally, that third appointment with me is, again, just with parents and caregivers, and that's when I provide feedback. So give you some information about how the patient performed, as well as recommendations, any associated diagnostics, and again, just how we're really going to help this child in real life, so at school and at home.